I launched the Good Living Health 3 weeks ago, and I'm very excited to bring you a new kind of healthcare. We are functional and integrative medicine. We look at the root cause of disease, that inflammation thing that can manifest to your health. We partner with you and give you knowledge and tools so that you can optimize your health. So today, I'm really excited to introduce you to Dr. Aimie. She is phenomenal, leading in functional medicine. She's expert in functional medicine, preventative medicine, and she's also specialized in attachment, post-traumatic stress and addiction medicine. And on personal note, I have so much respect of her work, and her knowledge is phenomenal. And here's Dr. Aimie.
Hello, everyone. Nice to be here with you. And yes, I am actually officially just triple board certified as of this morning. I got my results for my last board certification in addiction medicine. So I have preventive medicine, functional medicine, and now addiction medicine. And while that may surprise some of you, thank you, Sandra, that may surprise some of you in terms of like why addiction medicine and why does that have anything to do with anything that we are dealing with. That is really where I have learned so much about the chronic effects of stored emotions and trauma in the body and its effects on our biology. And that really is what we then come to the table with, trying to address those symptoms that we had, because whether they are chemical imbalances, adrenal fatigue, gut issues, even down to weight issues, those are all associated with the nervous system, our survival system. And so by default then, stored emotions and any traumatic experiences that we've had in our life that we actually didn't like fully complete that survival cycle. So that is where my addiction medicine really influences a lot of what I do and what I see, because when I see people, that lens is always there for me. I'm seeing not only their current symptoms, their diseases, conditions, their history, but then looking at those same symptoms and diseases and history through that lens of stored emotions and how that might be a piece of the puzzle that we also need to address. And for me, that certainly was my story. I actually started out as a surgery resident and did 4 years of surgery residency. And I was a very driven person. I would probably still say that I am. That's not a was. I am. I am still a very driven person, and had even adopted a son from the foster care system at that time. And it was right after I had to make the very hard and painful decision to adopt him out to another family that I started to have a health crash. And by a health crash, I mean that I was really struggling with weight. I was about 30 pounds overweight. I was in the 190s, and I was having such severe fatigue that I couldn't even respond to my pages or calls from the hospital without falling asleep before I could make that call back. And so I even had to take a medical leave because I got to the point where I could not get out of bed. I even had started to have some chronic pain with prior sports injuries that I had had. And so it was just like my whole world came crashing to a halt, and that was not me. I could not imagine life without being able to be outdoors and be back on my bike and be working and loving my work. And I determined to figure out and do whatever it took to find that level of health that I wanted. And what I've been able to find through my journey is that not only did I get back to a level of health where I could do that, but I am at a much better level of health than I was even before that, because of all that I've learned in terms of the functional medicine principles, and then bringing in the stored emotions and trauma piece, and then biohacking, and all of that together has been I mean, it's such a game changer for me. Like I honestly can say that I have the life that I love now only because of all these different pieces. And so I love sharing that with you guys, and I love helping you on your journey, wherever you are in that journey, because my journey, I can relate a lot to what you guys are going through, having had my own health crash and so many of the different symptoms and conditions. So that is who I am, and that is why I am here.
Can you tell us a little bit, how do we set up and prepare our body to lose weight? Because, as you know, toxin hold out, the fat cell hold out the toxin, and how that can be not effective if you like just go ahead and lose a lot of weight and have toxins circulate into your body.
Yes. Oh my goodness. Yes. So when we talk about weight and weight loss, there are a few key factors that we need to consider, or else it can go really bad. And when I was first starting, I of course at the time, I thought that all of my problems were because I was overweight. And so I thought that my energy problems were because I was overweight. I thought that, even some of my sports injuries may have been because I was overweight and not as flexible, not as lean as I had used to be. So I came to the conclusion that my weight was really my primary problem, and I needed to address that. And that then all my other problems would go away. I would be happy. I would be less anxious. All this kind of stuff. So I started a program, one of those programs where they send you meals, and the whole point is for you to go into ketosis, and the promise is you drop 14 pounds in 14 days, something like that. I cannot tell you how long I did that and started on this yo-yo weight pattern where I would be somewhat in ketosis for a few days, and then I just could not tolerate it, and I would come out and I would regain all of the weight and the water weight with that, and it was very discouraging, very frustrating, and I had no idea why. I thought that maybe this was just like a willpower problem, and I just needed more motivation, and I had no idea that it was just tearing up my biology, that my biology was not in a place where it could support that. And the foods that I was eating on that program were ones that I was sensitive to. And so those were causing all sorts of problems. And so it really comes down to, with the weight loss, understanding where your biology is. We need to be looking at nutrient deficiencies, because if we start throwing things at the problem, which is a downstream problem, without really understanding what is causing that problem, we can make things worse. So the situations in which it could make things worse would be, like you mentioned, toxins. So there are a number of toxins that can lead to this inflammatory state in our body. We have more inflammation, and when we have more inflammation, it's going to be very difficult, if not impossible, to lose weight in a healthy way that is sustainable, as those toxins, and many of them get stored in fat cells. And so as those fat cells start to decrease the amount of fat content, they release those toxins that are stored there. As those toxins hit our bloodstream, we start to feel awful. Mm-hmm. Some of the more common symptoms that people can experience are just irritability and anger. And for many of us, that's a big, big trigger, I would say. And it can bring up so many other past stuff, like maybe our mother was, angry and irritable, and this, reminds us of her, and we don't want to be like that. For whatever reason, anger is a very difficult emotion for many people to experience. And so it's a very common reason why people will say, nope, I will, I need to eat whatever I need to eat, do whatever I need to do in order to not feel this irritable and angry. And then there we are again with gaining weight, because now we are eating all this kinds of foods that we have, our brains have figured out in the past work with helping us feel less angry. So that is a common pattern that we see with toxins being released. Another common problem would be the food sensitivities, like I mentioned. When we have sensitivities to different foods, we will have this type of reaction as well, where we are even maybe eating less. And so we're already on a calorie restriction, already feeling angry, maybe anxious because of that. And then you add on the food sensitivities, which by themselves will cause an increase in inflammation across the body, even in the brain. And so then that will also lead to more symptoms, fatigue, brain fog, sadness. And so again, we get to the point where it's like we don't feel we can manage with that. And in order just to be able to get through our day, do our work, whatever our work may be, then we're back to eating those foods that, yes, led us to the weight gain, but helped us feel better and keep our emotions manageable. Some of the other issues are really related to the mitochondria.
Mm-hmm.
And so mitochondria are the factories inside each of our cells that make energy. And it really controls our metabolism then, because the more energy we're able to make, the faster our metabolism goes. And if there's any compromise of our mitochondria, then we have a slower metabolism. And so many times there are factors that cause the mitochondria to not make energy well. Toxins would be one of those. Inflammation would be another one of those. But then there's also things like chronic Lyme, chronic mold, viruses. And so any of those situations will compromise a person's metabolism and then offset that balance that they've established with calorie intake versus calorie output. And so for many people, right, the traditional thinking for weight loss has been just count the calories in, and the calories out has to be greater than the calories in. And that's really not true, because we're looking at all these different factors that have nothing to do with the calories. It really is just what's going on in the biology. And so the mitochondria become a big target for many of the peptides that work for weight loss. And so when we look at, is a person ready for a peptide, we really want to make sure that we've addressed these other issues first, because, and I have made this mistake before, where I will start a peptide that works on my mitochondria, and it's like revving up the engine without having any fuel in the engine. And it actually leads to a greater crash in your health, in energy, because you've got some compromise in your system that we have not dealt with first before asking the engine to go faster.
Mm-hmm. Mm-hmm.
The most recent example of that had to do with, I was coming out of COVID. And as part of that, like there had been a lot of fatigue, a lot of brain inflammation. And so I had gone back on my peptide that I use for that, which for me is the melanotan 2 peptide, in order to decrease the inflammation that I felt in my gut, decrease the inflammation in my brain, but it also acts on a person's metabolism and mitochondria. And what happened was that I was not fully through the COVID yet, and I crashed. Like, I felt worse after taking that peptide because my system wasn't ready for it.
Mm-hmm.
And so there's this preparatory work that needs to be done for us to really be able to use peptides and make sure that they're going to be of help and not actually hurt the process because we've introduced it too early.
Okay. So let me just track back a little bit. People might not know what ketosis is. Can you explain about ketosis?
Sure, absolutely. So ketosis has become popular in both the weight loss and bodybuilding spaces. And the reason for that is because when your body goes into fat burning mode, then it really is able to kind of accentuate the protein and the muscles and the tissues and just isolate fat loss. And so there's a diet that you do where you restrict your carbohydrates so that your body is forced to go from using sugars for fuel for that energy production, and it now is going to use up fats to make energy. And talking about our mitochondria, that's where all that happens. Usually our mitochondria take in sugars in the form of glucose, which comes from any source of carbohydrates, and uses those as their primary source for making energy. But it does have this mechanism that is the body's natural response to a fast or a famine, where in order to kind of preserve the function of the body on a lower calorie diet, then it switches to fat burning mode rather than sugar burning mode.
Mm-hmm.
So that is what ketosis is, and the gain in that is that it is, for many people, not for everybody, for many people, it is a very health promoting state to be in. Ketones have great benefits for the nervous system, for the brain, for the neurons. And so when you can be making those ketones naturally in your body because you're in a state of ketosis or fat burning state, there are many health benefits to that. There's many health benefits to fasting and intermittent fasting because of this. The problem comes when we don't have the system built for that level of fat burning mode. And so that's where a lot of people may attempt to do ketosis for either the weight loss or bodybuilding, and they end up feeling worse because in the process they release a bunch of the toxins that are stored in the fat cells, or again, they're using their mitochondria in a different way, which is a little bit of a stress on it just because it's different, and their body has no tolerance for any stress because they're already stressed to the max in other ways, right? It may be biological stress, it may be emotional stress, but they're already maxed to the stress to the max. And so then putting that additional stress on the body, it just makes it crash. I have seen many people, of course, being in the work that I do a lot with people around the emotional work and stored emotions and trauma work. When you are actively in the process of a big stress, a grief, those are not times to try to be in ketosis because your body really needs to run on sugars and carbohydrates during that time to get through. For some people coming in, they've already been eating a healthy diet for years. They are just looking for that next level. They're looking for, like a 10%, up leveling of their health and a little bit of weight reduction. And so they would be much more ready for that step towards peptides than someone else who is just coming in and they are very overweight. They have not been eating a healthy diet. They're not even sure what that is yet. They don't know anything about food sensitivities. They think they have inflammation, but they don't really know. That would require much more preparatory work, and not only some diet change first, but then also probably some laboratory work where we're looking at some of the nutrient deficiencies, some of the inflammatory markers, food sensitivities, toxin levels. Do we need to do a detox before we start on, revving up your metabolism and your mitochondria for weight loss? So when we see the weight loss just as a downstream symptom, and we're looking at what are the root causes of this, if a person has already identified and addressed many of the root causes, then we can jump much quicker to peptides and NAD than someone who has not identified any of their root causes yet, and we should start there. Saying that, the NAD is different because it's not I mean, I want to use the word dangerous, but I hate to attach that word to peptides. Peptides are not dangerous because they are a natural protein, a small protein that your body makes. So we're not introducing a foreign substance. We're not introducing a foreign medication. This is something that your body already makes, and we're just enhancing that message, that signal of that specific peptide. The danger comes if we're using it when the system is not built for a stronger message of weight loss or higher metabolism. With NAD, NAD is a cofactor that helps with energy production in the mitochondria. And so we're really talking about helping the mitochondria put more fuel into the tank. The peptides are asking the engine to rev faster, and the NAD is putting more fuel into the tank. And so even if a person has not done a lot of the preparatory work, NAD can be very beneficial in them just to help them have more energy to address all of the root causes. Because certainly for me looking back, I was so fatigued, like handing all of, my to-do list of all the things that I needed to do was overwhelming. And so if I had had that tool at that time and been able to use some NAD just to have some more energy in the process would have been really helpful. So in that sense, NAD can often be used much earlier in the process if someone is looking to need more energy short term just to be able to work through the root causes, knowing that NAD should not be seen as the solution, right? Just because you feel better doesn't mean that you get to stop. It just means that you can use that extra energy now to identifying the root causes so that you can even get to a better level of health. For those who are already fairly well optimized, NAD can be phenomenal. I still remember my first IV NAD and how I felt afterwards. Like the colors have never been brighter in my world. My mind has never been as sharp, as clear. I'm a fast driver to begin with. And I won't tell you like my drive home after the clinic that day, because like my mind was just super fast and super clear and accurate. And then I did go into the hospital later that day to do some work, see patients. I have never been able to type that fast and not make one mistake and not even be trying. Like that was the crazy thing for me was, there are times when I will intentionally force myself to have a higher production and concentration and focus. And this was just like, it was without any effort on my part. And it really felt like being superhuman. It was really cool. So that's the power of NAD when you are already at a level that's fairly optimized. Like it just takes you to that next level. But NAD can be used when a person is not at that level yet, just to help give them some energy to be able to do the work that they need to do, addressing and even identifying some of the root causes.
So Dr. Aimie, for my work, we have several of different peptides. Could you name some of the few that your favorite? Like for pain, for chronic pain, weight loss, sleep, or mental clarity?
Sure. And then I do need to run in a few minutes. So I will gladly share. What I think I'll share is just the ones that I'm on right now. And those would be, here's my list. And again, like everybody is different, right? And so this is where just because this stuff is working for me, that may not be what is best for your body. And we need to figure that out. But for me and my issues, I have had high autoimmune markers in the past, and I definitely deal with food sensitivities. And so increased inflammation, brain inflammation when that gets triggered. So those are always the things on the top of my list that I want to be addressing. And so on my list are the melanotan 2 is one that has consistently been a really good one for me. I initially used it not for weight loss, but many people use it for weight loss. My intentions for using it were to decrease the inflammation. It is neuroprotective. And so that was another reason why I wanted to use it, knowing the issues that I have with my brain. I've had several concussions in my past. So I have what's called primed microglia, where I have a predisposition to a huge inflammatory response in my brain in response to almost anything, whether it be emotional stress or inflammation in my gut or an injury or over exercising. Those are all common triggers for me for brain inflammation. So the fact that the melanotan 2 had these neuroprotective effects, I was like, ooh, I want that one. I also have had a number of burns in my lifetime. I was very much prone to a lot of burns as a child, being out in the sun for too long, and I have fairly, pale skin. And so I know that my risk for skin cancer is also higher. And the melanotan 2 is protective against skin cancer because it acts on the melanocytes. So those were my primary reasons for using it. And I saw all of the other effects as side effects that I didn't necessarily expect, but they weren't my primary purpose. And what happened, how my body responded to that is it did decrease the inflammation in my gut significantly, noticeably, within 24 hours actually. And with that, there comes just a lot of other benefits, because then my mind seems clearer and I have more energy and I just feel better because I feel less inflammation in my gut. And there is some nausea that I experience with the melanotan 2, which is one of the common effects, and how it also helps with weight loss. Like, you're just not as hungry. And I noticed that if I was eating more calories, probably more than what I needed to based on my activity level for that day, that's when I would have even more nausea. So that was really interesting for me, that it seemed to just depend on my calorie intake and being able to regulate that balance of, hey, we've had enough for today, let's not eat, and I'm going to take away your appetite because we don't need any more calories. And then the other things that I noticed, of course, I got a very nice tan. It looked like I had been vacationing in Hawaii, and I got lots of comments. And I did no longer burned. So I would go out into the sun and be out in the sun for significant amounts of time that before I would have had a burn, and I no longer burned, but I tanned. And then the other effect that it had that I definitely noticed was that it increased my sex drive, which was fine, but then it really increased the pleasure, I should say intensity, pleasure of the orgasm. That was something that I was like, ooh, I wasn't expecting that. So it not only did the things that I had wanted, that I had primarily used it for, but then it had all of these other interesting and cool benefits. So that has been one that I have actually stayed on, and am now just on a maintenance dose of that, for maintaining my inflammation and neuroprotective effects. The other peptide that I'm currently on right now is thymosin beta. And that is one that actually helped me the most coming out of COVID and helping my immune system get back on track and feeling well. So the melanotan 2 made things worse, because again, it revved up my mitochondria when my mitochondria were not ready for that. I was still pretty fatigued from the virus, but the thymosin beta was very helpful. So that is, again, one that I use primarily because of my predisposition to autoimmune conditions and symptoms, and knowing that my markers have been high. And so the thymosin beta does very nicely balance the immune system out. It's not going to turn it off. And that's kind of what I want, right? Like, I don't want my immune system to be turned off like the medications do for autoimmune things. I want it just to be in balance, because I want my immune system to attack things when it's supposed to attack things. I just don't want it attacking my own cells when it shouldn't be attacking that. So the thymosin beta has been really nice for that. I have done some experimenting around with thymosin alpha 4 for that same reason. I have not experimented with it long enough to really be able to give you guys solid evidence from my tracking that, hey, this has made a big difference, just because I've been using too many other things at the same time that I haven't isolated that for me to know, is this one making a difference like I have for the others. I also use quite a bit the BPC 157 peptide.
Yes.
And I probably use it differently than what most of you may be familiar with. So this is the peptide that really helps with tissue repair. And so most people use it for tendon repair, bone repair, injuries, and they're injecting it into as close to that site of injury as they can. And that is really where the benefit is. And there are many, I mean, this has been one of like the peptides that has been in the forefront for many athletes because like it works so well. There's just so much data, both in terms of research, but then also just people's personal testimonials for what this peptide has done for them, that it is amazing. However, I actually use the BPC 157 more as an oral capsule that I take in order to help repair my digestive system. And this is one that I will use for people who maybe have been drinking too much or have any development, any stage of a stomach ulcer or any stomach lining, digestive lining. Then the oral BPC 157 is much better for that than the injectable, probably. And so I use that consistently, just knowing that my gut is so sensitive and knowing that there's so many things that cause inflammation in my gut. That has just kind of been a staple for me that I will take on a maintenance dose now. The first treatment for that usually is a 30-day, everyday type of schedule. And now I'm more on a maintenance type of schedule for that, where it's just helping me maintain healthy gut lining. And then I will use the injectable BPC 157 if I'm having any musculoskeletal flare-ups of my chronic injuries. I've had, oh my goodness, I've broken my right collarbone 4 times. So I will often, have a flare up in that. If I push it too hard in my exercise, I do a lot of weightlifting. And if if that starts to be sore or it starts to pop more, then that's when I will use that injectable BPC 157 because it's much more targeted towards muscular skeletal, chronic pain, bone repair, collagen repair, tendon repair types of things.
Dr. Aimie, what about dihexa?
Dihexa is one that I use as well, yes. And so this is a cream or a capsule that you take. And the benefit of dihexa is that it, again, focuses on the brain, and it specifically focuses on those cells in your brain and your nervous system that are aging and need to be cleaned out. And so I see it kind of like as the cleaner, as taking out the garbage in the brain and the nervous system. And so there's a significant science behind the dihexa as being a peptide that is very protective against dementia and those, aging of the brain, that memory loss. And so that is something that I have all of my older patients on, and me as well. Yeah. The first step is just to meet with me, meet with Sutita, and see where they are in their process. Are they at a point where we can introduce the peptides, introduce the NAD? Are there steps that they need to take first? Can we introduce NAD in the meantime while they work on the other stuff? Just getting a good sense of knowing where they are and having a map for what is their next step and how to get there. that would be the next step. It's so individualized,
Mhm.
right? So individualized, and that's where there can be the potential harm, right? In my case, using melanotan 2 when my body wasn't ready for it and it crashed, and I wouldn't want that to happen for someone. And so the benefit of meeting is being able to say, hey, like, given your biology, this would be the best fit for you that we can try. I will take these 2 questions, and then I did have a hard stop at 12:30, so I will let Sutita answer all the other questions. How's
Sounds
that?
good.
Okay.
Okay. So there are a number of injectable peptides, and most of these are subcutaneous injections, which means that you're injecting into your fat, usually your belly fat, and it's with an insulin needle. So you don't feel it. It's just like injecting insulin if you were a diabetic. It's not a big deal. It's something that you can easily learn how to do. I have many people who've never done anything like that, let alone do an injection on themselves. And I walk them through it the first time, and they've gotten very comfortable with it. So don't let the injections scare you away. It's a subcutaneous injection into your subcutaneous fat with an insulin needle. So, and there's videos to walk you through all of that. In terms of a roadmap, not only would it be based on symptoms, but it would be based on laboratory work. And so in the meeting, that's what we would also want to review with you, is like, have you share all the labs that you've had in the past, so that we can also have that influence our understanding of like the big picture of your biology, to then know what your next steps are. I mean, your next step might be more laboratory work that is specific to your mitochondria, that is specific to understanding inflammation, understanding, the extent of your gut issues. Maybe you've already had all of those tests. Maybe based on your symptoms and your history, you don't need those tests. So it's so individualized, but that all comes into play with your customized, individualized roadmap, is laboratory work, symptoms, and your history. And by history, I really mean like a very detailed timeline of significant events in your life, certain symptoms in your life. When did those start? Medications you've been on, surgeries you've had, any accidents, like all of that plays a role, because it really tells me a lot of what might be going on in your body, because there's very predictable patterns that happen as a result of, certain injuries or certain accidents or certain symptoms. There's very predictable patterns that we know that really influence then, hey, like this would be probably the best benefit for you, and this would probably be harmful for you at this point, and we need to do this first.
Thank you, Dr. Aimie.
Very nice spending time with you guys.
Thank you. So when I first see the client coming in to discuss about the weight loss, like Dr. Aimie said, that we look into extensive of your history, okay? And one of the things is the major cause of imbalance is, are you vitamin deficient? Are you taking enough nutrient? What kind of medication that you on that impair and suppress your mitochondria? When I look at that, we're looking into your gut health to see if you need to have your microbiome balanced first before you go to the next step of detox and all that. First, we look at all the food component, and we work with food that you can optimize your health, really enrich your body first before we can remove those toxin substances she's talking about. And certain thing that I advise that you can prepare your body, to before you can detox. You have to support your liver, okay? And we'll go over the pathway, how we can eat the food or drink, or the method we can support the liver before we do the detox. We have to support the limbic system, that the drainage system. If you are clogged up, you're not you're not, you're constipated, your limb is clogged up, you are not going to lose weight. We look at your hormones to make sure that your hormone is not affected, that they are balanced before we can do that. But yes, we, really gear into what kind of food that you eat. If you are vegan, you're most likely going to be deficient in your B6 and B12, and that is the such a significant nutrient to help your mitochondria and methylation to give fuel to your energy and heal your body. So we look into the root cause of the problem. You can come in to say you have excessive hair loss. And so then we will go over your history, what kind of food you eat, the stress level, what kind of environment exposure that you have. So once we all work into that path, I try to harmonize the body. We have a team of acupuncture. We have a team of yoga and meditation, working on getting our body to calm down. So when we in the calm parasympathetic stage, our body gonna prioritize rest and sleep and healing. If we constantly in the stress mode, we are gonna keep driving cortisol. So our body gonna prioritize running away from the tiger. So we're not prioritize the rest and digest and healing. It's a different kind of healthcare. We give people a lot of time to spend, balance their emotional body, that everything is interconnected. Knowledge is the key that we can empower our people to really step up to their health.